talk a little bit about Nicholas O'Keefe, and the reason why I think Nick's a great patient to discuss is because there are a lot of people like Nick with very advanced osteoarthritis, and it's not felt because I think we're a little bit historical in terms of where surgeons perceive osteotomy can actually be effective. But osteotomy can work in severe advanced osteoarthritis, and Mr. O'Keefe has got really advanced arthritis in both knees with failing or failed medial compartments, which are bone on bone. And I want to talk you through the history and then talk you through the x-rays and the results. So Nick, you're 55?
56 now. 56.
And he, like most people, enjoys his sport. You like golf.
Yep.
And you're an active guy. And you came to see me back in September of last year with pain in both knees, but particularly the left knee, because you're on crutches.
On crutches, yeah. I couldn't walk without
and
crutches.
You could only walk literally a few yards, couldn't you? Because of the advanced pain, because of the severe pain that you had. And that was on the inside of the left knee, wasn't it, primarily?
Primarily, yeah.
And if we look at the x-rays, if we look at the pre-op x-ray here, you can see how bent or varus the leg was, and we've dropped a weight-bearing line in from the middle of the hip to the middle of the ankle, and this is bone on bone on the inside here, very advanced arthritis. So when I met Nick, he had about 15 degrees of fixed flexion, which means he couldn't get his leg straight, and also his leg was quite bent or varus. We talked about the options. We talked about the options of injections and bracing, and we talked about osteotomy. And because he was so bent and had such a significant fixed flexion, he wasn't a suitable candidate on the left for a partial knee replacement. We couldn't have got away with that. So it was a total knee replacement or joint distraction, which is actually something that I would have gone for over a total knee, or what we did, which was a double level osteotomy. So we've done an opening wedge osteotomy here in the shin to straighten the leg by making a cut and opening the bone, and we've done a closing osteotomy of the femur at the same time, and that allowed us to get the leg nice and straight. And if we look at the x-ray, you can see the plumb line now from the middle of the hip down to the middle of the ankle. And how much pain did you have after that first one?
Very, very little. Very little. No.
Obviously pain to say that. But
there was no pain in the actual knee itself. There was tightness in the skin and everything around it, and in the muscles, and it felt swollen. But there was no.
And we used a cryotherapy device. So this is not magic. This is a combination of doing fast surgery as a team. 3 of us did the surgery with Christian Clay. We did a minimally invasive approaches, and we used a cryotherapy device afterwards, and we sent him off for rehab at the Clavdor, and he did very well. And you came back for the other side, and we did the right side about 8 weeks later.
7 weeks later.
7 weeks later. So there's the left side. There's a close-up of the left side, and you can see the closing wedge in the femur here, and you can see an opening wedge here on the left side. And then if we look at both together, you can see through small incisions we've put the femoral plate, tibial plate, and closing, opening, and there now we've got the weight-bearing line through the middle of the knee. So what can you do now that you're off your crutches, you're a few months down the line? How do they feel?
I feel great, the knees themselves. The muscles, I'm still getting used to, or building the muscles themselves back up.
Yeah.
But I'm walking up to about 1.5 miles a day now.
Excellent.
Without any pain in the knees themselves at all.
What about that original pain that you had where you just couldn't take weight?
Nothing.
Went quite quickly though, didn't it?
Very quickly.
Yeah.
Very quickly.
And how long have you had pain? Because you first damaged your knee when you were
17. Yeah, we snapped the cruciate in this one. Yeah. So I've had pain all my life with
it.
You
just sort of managed it, haven't you?
Yeah, just the different levels of severity. But then I did get to the point where I was having regular acupuncture, which helped. But obviously March came along and the lockdown, and the acupuncture went.
And how bad was the pain before we? It stopped you walking. What about sleeping?
Sleeping, doing anything, even just concentrating. I mean, I was at the point out of 10, I was at a 9.5.
Yeah.
When I first came.
Yeah. what we see with osteotomy is, even in these extreme cases, I mean, look, we can't guarantee, Nick, 10, 20, 30 years of this, but many of our patients never come back.